While we're walking into the patient's room, we'll assess the door for any flags or markers, such as fall precautions or contact precautions. Walk into the patient's room, perform hand hygiene, assess for any environmental hazards, such as IV poles, trash on the floor. Hi, my name's Sarah. I'm going to be your nurse for the day.
Hi, Sarah.
Can I see your armband? And can you verify your name and date of birth for me?
Rebecca Smith, January 1st, 1992.
Okay, great. And do you know where you are today?
Johnson West.
What's today's date?
Friday, December 2nd.
And on a pain scale of 1 to 10, 1 being least amount of pain and 10 being the most, are you in any pain right now?
No.
Alright, patient's laying supine, the head of the bed elevated at about a 30-degree angle. She appears calm and relaxed. Skin color is appropriate for ethnicity. She has good skin turgor. She has no speech or hearing deficits, as she's answering all of my questions appropriately. Her personal hygiene is clean and neat, and she is dressed appropriately for the season. She's A&O times 3 to self, time, and place. And I'm just going to do a pupil assessment real quick. Do you mind looking at this for me? Alright. Her pupils are about 4 millimeters. They are reactive, round, and accommodating to light. I'm just going to perform a motor test now. Can you squeeze my fingers for me? Alright, and lift your hands above your heads for me. Okay. And can you push your feet against my hands? Alright, and back towards you. And can you extend your knees to your chest? And the other one. So there's no motor deficits, and her upper and lower muscle strengths on both sides are intact and equal. No ptosis or facial droop noted. Can you tell where I'm touching?
My foot.
What about now?
My knee.
And now?
My hand.
Alright, so her sensation is good. Her communication is logical and coherent. Can you swallow for me? Does that hurt or anything?
No.
Alright, so her swallowing is good. No dysphagia noted. I'm just going to perform a respiratory assessment. Do you mind sitting up for me? Gonna auscultate anterior and posteriorly. And when my stethoscope touches your skin, will you take a deep breath for me?
Yes.
Alright, front side. Alright, her breath sounds are clear to auscultation, anterior and posteriorly. Her breathing is unlabored and symmetric. She is not on any supplemental oxygen. If she would, I would assess for the flow rate, make sure everything was working properly in the liters per minute. Can you cough or can you take a deep breath and cough for me? Alright, so she has a dry, non-productive cough. If it were productive, I would assess the color and amount of mucus. And if she had any problems deep breathing, I would educate her on the use of an incentive spirometer. So now I'm just going to do a cardiovascular assessment. Listen to all your heart sounds. Alright, so the apex of the heart. I'm going to auscultate your apical pulse at the mid-clavicular line simultaneously with the radial pulse for a full minute, and there's no pulse deficit noted. So then I'm just going to listen to your heart valves real quick. So aortic, pulmonic, Erb's point, tricuspid, and mitral. And I'd repeat with the bell. Everything sounds good there. Can I see your hands real quick? I'm going to check your capillary refill. It's 2+. It's a good reaction. And I'm just going to check for some pretibial edema, swelling in the lower extremities. There is none noted. So I'm going to do your posterior tibial pulse and your dorsal pedal pulses. They are 2+ in bounding. And at this time I would check for any IV sites, which there are none. And if she did have it, I would check the site of the IV for redness, skin breakdown or anything, and then the rate of the fluids. Her skin temperature is warm and dry. Skin color again is appropriate to ethnicity. She has no lesions present, no dressings. If she did, I would assess to make sure there was no drainage or anything coming out of them, see if they needed to be changed. She has no skin breakdown, and if she did, I would assess on the Braden scale. I'm just going to take a look at your abdomen. Do you mind pulling your shirt up for me? Alright, so it's flat and symmetrical. I'm just going to auscultate your vowel sounds. Right lower quadrant, I'm just going to go around. Alright, vowel sounds are intact. I'm just going to palpate, see if you have any tenderness. Does that hurt or bother you or anything?
No.
Okay, great. So when was your last bowel movement?
This morning.
Alright, and do you ever really get any diarrhea or constipation?
No.
Okay, so this lets me know that she's tolerating her diet well. Do you have any problems voiding?
No.
Any burning or pain when you urinate?
No.
Okay, so if she had a Foley catheter, I would assess color, clarity, amount, and smell of the urine. If she was on bed rest, I would assess for head of the bed elevation, but she's not. She has no TEDs, SEDs, foot pumps present. She's an assist time 0. She is not a fall risk. She's pretty ambulatory on her own, independent. She can transfer to the chair on her own. No need for walkers, ambulatory devices, cane. She's pretty good on that. So no fall risk scale necessary. So at the end, I would make sure her bed was at the lowest position. Call bell was in reach. Side rails were up. She had a bed alarm. Brakes are locked. And if you need anything else, I will come right back and I'm going to go document. Have a great day.